the overemphasis on taking a day off or, having some flexibility in your day or using your employee resource program or, taking your lunch, those are going to have marginal impact on moving the dial and people's mental health. It's actually organizational strategies that are going to be really important. So for example, it's what's more impactful than telling a person, did you contact your EAP and use, are you thinking about getting some counseling, or, maybe you need to get some more sleep and exercise, and here we're going to give you a free gym membership. What's more powerful than that is taking a close look at whether or not your hybrid work policy is working and whether or not it needs to be rejigged, and actually looking at the research on what actually makes teams that are working in person effective and makes that engagement meaningful, and focusing on that, specifically zeroing in and narrowing in on those particular aspects of hybrid work and making the experience of when a person comes to the office meaningful, so that they've had a good day instead of a crappy day, and then you go tell them to use the gym. So what makes for good mental health when people are working together? The research shows that people work more effectively from home when they are doing their day-to-day tasks. So when you're doing your day-to-day stuff at your desk, tasks, you get more done when you're at home. So do not call your people into the office and expect them to have as positive a day and as positive of a mindset around getting the work that they could be doing more effectively at home done at work. When people come into the workplace, if you're bringing them in once a week, or you're bringing them in twice a week, you're bringing them in 3 times a week,
4 times a week. Like, I would say that a lot of workplaces are increasingly pushing their team members to be in person for 4 days and some even 5. And so, I'm seeing Disney on
and that, like, I'm not saying that definitively doesn't work. That's not the case. Where workplaces are most effective is when people are coming in, and I can see creative environments being good for this, for what it's worth. The work is, it's generative work, it's close connection work, it's in-person meeting, creative, brainstorming, problem solving, that level of work. So your day-to-day don't need to be interacting with people, should not be happening. You should not be bringing people into the office to do work that they could be doing at home. It should be specifically designed. That's a mental health strategy, believe it or not. So I'm just going to say one more thing, which is that as we all worry about DEI and what's going to happen with DEI, with a possible recession, and is our work going to get, reduced, and are we going to get cuts to our budgets and stuff? One of the number one strategies that I have for so many of you that are DEI like professionals is to link your work to psychological safety, employee engagement, and mental health. Do not treat those concepts as separate. If you are doing DEI work, you are doing mental health work. So, and that's key, because when you switch out of talking about DEI, like specifically in the silo that's actually imposed upon us, because we know better as people with lived experience, we will speak about things like hybrid arrangements, things like employee programs, things like creative opportunities for people to brainstorm and new products and things like that, because they are all intersectional and linked to each other in terms of what's happening for people in the workplace.